Welcome to Idea Sessions. In this video, we will cover every mental disorder. Anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive fear, worry, or nervousness that interferes with daily life. These disorders can affect both mental and physical well-being, leading to symptoms such as restlessness, difficulty concentrating, muscle tension, rapid heartbeat, and sleep disturbances. Common types of anxiety disorders include generalized anxiety disorder, GAD, where individuals experience constant worry about everyday situations. Panic disorder, marked by sudden and intense panic attacks. Social anxiety disorder, involving intense fear of social situations or being judged. And specific phobias, where individuals have irrational fears of specific objects or situations. Anxiety disorders can develop due to genetics, environmental factors, or stress. Treatment typically includes therapy, such as cognitive behavioral therapy, medications, like SSRIs or benzodiazepines, and lifestyle changes, such as stress management techniques. Early treatment is essential to manage symptoms and improve quality of life. Mood disorders. Mood disorders are a group of mental health conditions primarily characterized by disturbances in a person's emotional state, leading to significant mood swings. These disorders can affect how a person thinks, feels, and behaves, and often disrupt daily functioning. The two most common types of mood disorders are depressive disorders and bipolar disorder. Depressive disorders, such as major depressive disorder, MDD, involve prolonged periods of sadness, hopelessness, and loss of interest in activities. Bipolar disorder, on the other hand, is characterized by extreme mood swings between periods of elevated mood, mania or hypomania, and deep depression. Mood disorders can result from a combination of genetic, environmental, and biochemical factors. Symptoms can vary from mild to severe and may include changes in sleep patterns, appetite, energy levels, and concentration. Treatment typically involves therapy, medication, and lifestyle changes, with early intervention improving long-term outcomes. Obsessive-compulsive and related disorders. Obsessive-compulsive and related disorders, OCDRD, are a group of mental health conditions characterized by the presence of unwanted intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed to reduce anxiety or prevent a feared event. Obsessive-compulsive disorder, OCD, is the most well-known condition in this category, where individuals experience distressing obsessions and feel compelled to perform certain rituals to alleviate the anxiety caused by those thoughts. Body dysmorphic disorder, BDD, involves an intense preoccupation with perceived flaws or defects in physical appearance. Hoarding disorder is marked by difficulty discarding possessions, leading to clutter and distress. Trichotillomania, hair-pulling disorder, and excoriation, skin-picking disorder, involve repetitive behaviors like pulling hair or picking skin, often as a response to anxiety or stress. Treatment for these disorders typically includes cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, and medications like selective serotonin reuptake inhibitors, SSRIs. Early intervention can help manage symptoms effectively. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after experiencing or witnessing a traumatic event, such as combat, natural disasters, accidents, or violent assaults. It is characterized by persistent and distressing symptoms that interfere with daily life. Key symptoms of PTSD include intrusive memories, flashbacks or nightmares, avoidance of reminders related to the trauma, and hyperarousal, such as being easily startled, having difficulty sleeping, or feeling tense. Individuals with PTSD may also experience emotional numbness, difficulty trusting others, or feelings of detachment. PTSD can affect anyone who has faced trauma, but certain factors such as previous trauma, lack of support, or genetics may increase the risk. Treatment often includes cognitive behavioral therapy, CBT, particularly trauma-focused CBT, and medications like SSRIs. Early intervention is crucial for managing symptoms and improving quality of life. Eating disorders. Eating disorders that are serious mental health conditions characterized by unhealthy eating habits and distorted attitudes toward food and body image. These disorders often involve extreme behaviors related to food, weight, and body shape, leading to significant physical and emotional consequences. The most common types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia involves extreme restriction of food intake, an intense fear of gaining weight, and a distorted body image. Bulimia is characterized by episodes of overeating followed by compensatory behaviors, such as vomiting or excessive exercise. Binge eating disorder involves recurrent episodes of eating large amounts of food in a short period without compensatory behaviors. Eating disorders can result from a combination of genetic, psychological, and sociocultural factors. Treatment typically involves therapy, such as cognitive behavioral therapy, nutritional counseling, and sometimes medications. Early intervention is crucial for effective recovery. Psychotic disorders. Psychotic disorders are severe mental health conditions characterized by a disconnection from reality, often leading to symptoms such as hallucinations, hearing or seeing things that aren't there, and delusions, false beliefs. These disorders can significantly impair an individual's ability to think, feel, and behave clearly. The most well-known psychotic disorder is schizophrenia, which involves a combination of symptoms, including delusions, hallucinations, disorganized speech or behavior, and cognitive difficulties. Delusional disorder is another type of psychotic disorder where individuals experience persistent false beliefs without the other typical symptoms of schizophrenia. Psychotic disorders can arise from various causes, including genetic factors, brain chemistry imbalances, trauma, or substance abuse. Treatment often involves a combination of antipsychotic medications and psychotherapy, such as cognitive behavioral therapy. Early diagnosis and intervention are critical for managing symptoms and improving quality of life. Support from family and mental health professionals is essential for recovery. Neurodevelopmental disorders. Neurodevelopmental disorders are a group of conditions that affect the development of the brain and nervous system, impacting various aspects of cognition, behavior, and social functioning. These disorders typically manifest in childhood and can persist throughout life. Common neurodevelopmental disorders include autism spectrum disorder, ASD, which affects social communication and behavior, and attention deficit hyperactivity disorder, ADHD, characterized by inattention, hyperactivity, and impulsivity. Intellectual disabilities involve below-average intellectual functioning and limitations in adaptive behavior, while specific learning disorders, such as dyslexia, impact skills like reading, writing, and math. The causes of neurodevelopmental disorders are often complex, involving a combination of genetic, environmental, and prenatal factors. Early diagnosis and intervention are essential for managing symptoms and supporting development. Treatment may involve behavioral therapy, educational support, medications, and family counseling, aimed at improving functioning and quality of life. Early support can significantly enhance long-term outcomes. Personality disorders. Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, thinking, and feeling that deviate significantly from cultural expectations. These patterns are inflexible, pervasive, and cause significant distress or impairment in various areas of life, including relationships, work, and social functioning. Common types of personality disorders include borderline personality disorder, BPD, which involves intense emotional instability, impulsivity, and difficulty maintaining relationships. Narcissistic personality disorder, NPD, characterized by an inflated sense of self-importance and a lack of empathy. And antisocial personality disorder, ASPD, marked by disregard for others' rights and social norms. Other types include avoidant, dependent, and obsessive-compulsive personality disorder. Personality disorders often have complex causes, including genetic, environmental, and developmental factors. Treatment typically includes psychotherapy, such as dialectical behavior therapy for BPD, and sometimes medications to manage symptoms. Early intervention and ongoing support are key to managing these disorders. Dissociative disorders. Dissociative disorders are a group of mental health conditions that involve disruptions in memory, identity, perception, or consciousness. These disorders are often a coping mechanism in response to trauma, particularly childhood abuse, and they can cause individuals to disconnect from their thoughts, feelings, or sense of self. The most common dissociative disorders include dissociative identity disorder, DID, formerly known as multiple personality disorder, where an individual experiences two or more distinct identities or personalities. Dissociative amnesia involves memory loss related to personal information or traumatic events without an underlying medical condition. Depersonalization. Derealization disorder is characterized by persistent feelings of detachment from one's own body or the external world. Dissociative disorders often result from overwhelming stress or trauma. Treatment typically includes psychotherapy, particularly trauma-focused therapies, to help individuals process and integrate their experiences. Medications may also be used to address symptoms like anxiety or depression. Early intervention is crucial for recovery. Substance use disorders. Substance use disorders, SUDs, are a group of conditions characterized by the harmful or excessive use of substances, such as alcohol, drugs, or prescription medications, leading to significant distress and impairment in daily life. Individuals with SUDs may develop a strong craving for the substance, engage in risky behaviors, and experience withdrawal symptoms when not using. Key features of SUDs include tolerance, needing more of the substance to achieve the desired effect, physical dependence, and difficulty controlling usage. Common substances involved in SUDs include alcohol, nicotine, opioids, cocaine, marijuana, and prescription drugs like painkillers or benzodiazepines. The causes of substance use disorders are multifaceted, including genetic, environmental, and psychological factors. Treatment typically involves behavioral therapies, support groups like 12-step programs, and sometimes medications to manage withdrawal or cravings. Early intervention and continuous support are crucial for recovery and to prevent relapse. Sleep disorders. Sleep disorders are a group of conditions that disrupt the normal sleep pattern, leading to difficulties with falling asleep, staying asleep, or feeling rested upon waking. These disorders can impact physical health, emotional well-being, and daily functioning. Common types of sleep disorders include insomnia, characterized by trouble falling or staying asleep. Sleep apnea, where breathing repeatedly stops and starts during sleep, often causing loud snoring and daytime fatigue. Narcolepsy, a condition marked by excessive daytime sleepiness and sudden sleep attacks. And restless leg syndrome, RLS, which causes an uncontrollable urge to move the legs, particularly at night. Sleep disorders can be caused by various factors, including stress, medical conditions, medications, or poor sleep habits. Treatment often includes lifestyle changes, cognitive behavioral therapy, CBT, and sometimes medications. Proper diagnosis and early intervention are essential to improving sleep quality and overall health. Somatic symptom and related disorders. Somatic symptom and related disorders are a group of mental health conditions characterized by physical symptoms that cannot be fully explained by medical conditions, but still cause significant distress or impairment in daily functioning. These disorders involve a focus on physical sensations, leading to excessive worry, fear, or concern about health. The most common disorder in this category is somatic symptom disorder, where individuals experience persistent physical complaints, such as pain or fatigue, that are not fully explained by a medical condition but cause significant distress. Illness anxiety disorder that involves excessive worry about having or developing a serious illness, despite little or no symptoms. Conversion disorder that involves neurological symptoms, paralysis or seizures, that are not linked to a medical condition. These disorders often have psychological factors at play, such as stress or trauma. Treatment typically includes psychotherapy, such as cognitive behavioral therapy, stress management, and sometimes medication to address underlying anxiety or depression. This list includes just a few of the many recognized mental disorders. Diagnosis and treatment typically require professional evaluation and intervention. We hope this video helps you, and check out our other video related to mental health.